the symposium and also the oral presentation agenda today. I hope you stay and mute the audio, please, to make the condition is really conducive. Okay, thank you so much. Honorable speakers today, Professor Smriti Mani, OSD Nursing, Nursing Directorate Government of West Bengal, India, and all honorable participants, Assalamualaikum warahmatullahi wabarakatuh. Good morning, selamat pagi. First of all, let us say thanks to God who has been giving us guidance, healthy, and also blessing, so we can attend and participate in this second day of the 4th International Conference on Nursing and Health Sciences in the Sunday, 20 March 2022. Without any obstacles, and I would like to welcome to you for your attend and this session on symposium first, and then the second session is oral presentation. Ya, Bapak Ibu sekalian, yang saya hormati, Bapak pembicara kita, Profesor Smriti, dan juga para partisipan, terima kasih dan selamat datang, selamat pagi. Pertama-tama kita sama-sama memanjatkan puji dan puji syukur kepada Tuhan Yang Maha Kuasa, karena berkat rahmatnya dan juga keberkahannya, pada pagi hari ini kita kembali di hari kedua dari International Conference on Nursing and Health Sciences, Minggu 22. Harapkan Bapak Ibu tetap mute audio agar acara hari ini berjalan dengan kondusif. Dan saya juga mengucapkan selamat datang pada sesi yang pertama, yaitu simposium. Setelah ini baru kita akan memasuki sesi kedua, yaitu oral presentasi. Before we continue our agenda, let's take time for pray based on our self-belief and religion. Sebelum kita memulai acara ini, mari bersama-sama kita berdoa menurut agama dan kepercayaan masing-masing. Pray, begin. Berdoa dimulai. Finish? Ladies and gentlemen and honorable speaker, my name is Akwar Tuti or Tuti. I will be a moderator in this symposium. And before the symposium begin, let me to say hello first to our honorable speaker, Professor Smriti Mani. Good morning, Professor.
Good morning. I'm so happy to be here with you all.
Yes.
Am I audible? Am I audible?
Thank you, Professor. You're very attractive today. You have healthy and good condition?
Yeah, thank you. I'm happy. What about you all?
Okay, well, thank you so much. Okay, Professor, before you start your presentation, let me read your outstanding curriculum vitae briefly. Okay, maybe the committee, you can share the curriculum vitae from Professor Smriti Mani. Ya, mungkin sebelum kita memulai acara dan juga penyampaian materi dari Profesor Smriti, kita akan mengenal terlebih dahulu Profesor Smriti.
So, can I start?
Oh, yes, you're ready to start your presentation by your professor?
Yeah. Is my screen visible?
Yes, I can see. Okay, if you want to start your presentation, it's okay with your share screen sharing. Oke, baiklah, kan Profesor sepertinya sudah siap untuk menyampaikan materinya. Beliau akan menyampaikan materinya secara langsung. Oke, Profesor, you have 20 minutes for giving the presentation. After that, we're waiting to the second speaker, and then after that, we open this discussion and also answer and question session. The discussion will be panel discussion. Is okay?
Yes, please.
Okay, thank you so much. Oke, teman-teman, ini akan berlangsung panel diskusi. Jadi setelah Profesor Smriti Mani, maka kita akan menunggu dan juga mendengarkan penyampaian dari pemateri kedua, Profesor Abir. Setelah itu baru kita akan membuka sesi tanya jawab. Kami berharap acara akan berlangsung seperti itu. Oke? Okay, ladies and gentlemen, and Professor Smriti Mani, you're ready. Thank you so much for taking your time and claim your please.
So first of all, I would like to say that the organizers, thank you very much to select the topic, that is the strategies undertaken for health system transformation for improving maternal and child health. Really, this is a very good topic. I will say rather, you have chosen the very excellent topic. So I want to tell that the universal health access will not be achieved unless women are cared in their own communities, and not only that, are empowered to take decisions about their own health in a supportive environment. This will not only be achieved by the community-based maternal health access. So we are thinking that in India also we are thinking that a special cadre, a dedicated cadre like nurse practitioner midwife can take the responsibilities of maternal health and newborn. So if you see that the
Okay, Professor Smriti, I'm sorry, you can full screen your presentation, maybe.
I is it full screen? You can't see it full screen.
No, it's not full screen in my screen right now. In your laptop is already full screen?
No, it's showing full screen.
Oh, we cannot see the full screen here, and the presentation is stuck. Doesn't.
Okay, now stop.
You can.
Maternal death ratio is a negative indicator. We know it very well. All the country, we know that if maternal death ratio is high, then we say that the utilization of health services is not going on properly. So if we see that the maternal death ratio is high, so it is the tip of the iceberg that reveals that the magnitude of the pregnancy-related conditions, that means the near-miss events, near-miss morbidity, other potentially devastating consequences after birth, or the long-term psychological or social or economical consequences of there are must, because maternal death ratio is that is the showing the tip of the iceberg only. So for that reason, we have to take care of this one very much. Actually, if we see that what is the reason behind it, we have seen the all over the country where the maternal death ratio is high. We have seen that the lack of skilled birth attendants, delay reaching in the health center, or delay in referral for emergency obstetric care, or delay or poor implementation of the intervention, whatever at the facility level, the vertical delivery of the care in which single element of care are implemented without connection with the comprehensive care. That means the one center will give up to this, and then higher center will do the cesarean section. This type of vertical delivery system, vertical delivery of care, it is really hampering the intervention, proper implement and creating delay also. So in our India, if you see the current maternal mortality is 99, and IMR is 29, and NMR is 28. So if we can reduce all those current indicators, then only we will be able to reach the maternal mortality ratio in a negotiable manner. So if we see that what are the managing change or innovations are there. So transforming health services, we have to transform and transform the health services. Yes, madam.
Yes, your presentation doesn't move.
Doesn't move.
Doesn't move. We just not a full screen and not move into the next slide. Stay in first slide.
Oh.
Maybe if you give me permission, we will.
Yes, please. I will stop sharing. I'm stopped sharing.
Okay, thank you so much.
So you do it.
Maybe you will share. You can share the Professor Smriti's PowerPoint presentation. Okay. What the?
Yeah, next.
The presentation, Prof. Next.
I have already told.
Next.
Yes. Yeah. I have already discussed this one also.
Next. Lagi Mas Arya?
Yeah. Here we have to manage the changes and the innovations we have to take in our maternal healthcare service. So the transforming health services and moving towards the universal health coverage. How can we get it? We have to enhancing the health workforces. So if our skilled, knowledgeable workforce are there and a dedicated workforce are there who are always serving to provide care to the maternal health, then we can we can transform our health services. Not only that, we have to ensure the equitable access to cost-effective medicines and technology, so that all the persons, whosoever they are in rural area or in urban area, they are getting the equitable access to the cost-effective health services. Not only that, that the boosting the health intelligence, that is also required, and for that reason we have organized the conference. And so all the nurses, all the midwives, we have to enhance, enhance our intelligence, our skill, or then only we will be able to manage the changes and innovation. Next slide, please. How can I do like that? So we have to think that if we take that whole thing, that is the process of care. So process of care, competent care and system. And not only that, positive user experience. For that reason, respectful maternity care is coming. So positive user experience is also, we have to preserve that. Not only that, quality impact. So for the better health, one is the confidence in system, another is the economic benefit. Two things. And how can I go to the process? Our population must be health needs and expectation. We have to assess. We have to govern the policies, insurance, and the non-health sectors. Also, we have to involve. Not only that, our platform will be accessibility and organization of care, and workforce will be numbers, skills, and support. Tools will be our equipment, medicines, and data. If we are, these are our foundation. If we are founded with all those things, then our process of care will be the competent care and the system. And not only that, positive users will come to have this care. So on that, we can have our quality impact. So these are the things, and the population, the persons will be there, and all equitable distribution of all services, and must be resilient and efficient. So if we can do like that, so the high quality health system in sustainable development goal, we will be able to get it. So next please, next slide please. Yes. So if we see the input, process, and outcome, how can we do all those things? Our service delivery, our health workforce, our informations, our medical products, vaccines, technologies, our finance, our health infrastructure, our leadership and governance. All those things are inputs. That means our input. So that all inputs, if I putting in our health system, and the process are, we have to find out the pregnant women, we have to access them, we have to cover them, we have to link them, and we have to treat them with quality of care and evidence-based care, and we have to retain them, so that if we maintain the patient safety, if they have the positive experience, so they will retain and they will have the patient safety also will be able to do. So if these are the process, then our outcomes will be really good. That is the maternal and neonatal and infant morbidity will reduce, maternal, neonatal and infant mortality will reduce, and of course the improved effectiveness and sustainability and gender equality will come. So in this case, that is the input, process, and output. These things we have to keep in our mind, so that if we have to concentrate on our input and process. If we take care of those things, then automatically outcome will come, and we will be able to take these strategies will help us to reduce the maternal and neonatal mortality and morbidity rate. Next slide, please.
Lanjutnya.
Yes, we have to, how can we improve our maternal health in areas of conflict? Yes, the empowerment of women. So they have to come to take the services. So if women are not empowered, then it's not possible. So for that reason, education, empowerment, continuously health education to empower them. That is the main thing we have to improve, so that if they understand their own health, they will be able to come to have the services, and ultimately, indirectly, we will be able to reduce the maternal mortality rate, and use an integrated approach that delays. So we don't want to see delays model. We don't want any delay. Whenever they will realize the condition to seek help and coming to the institution when we are starting and the treatment. So all those things we have to do an integrated approach. I'm sending from a rural area, but nobody is taking care in that third labor layer. So this integrated, without any integrated approach, it is not possible to improve the maternal health. Not only that, provide the access to contraception and safe abortion services. So that people will not go to anywhere else to get their safe abortion. So if we are doing like this, that we are covering all those things, and we are not giving the contraception to adolescents and all, so that they will be pregnant. This is a normal phenomena, and after that they will go for an unsafe abortion. So we may lose that woman. For that reason, we have to provide the free access. I have observed in Sweden that they are the free access to all contraception. All adolescent clinics are also just distributing the contraception. Doesn't matter, because we want their safe health. So make response to the context specific. That means support health system also strengthening at all levels. And of course, this is the women's health, but the men should be involved, because if men are not involved in these services, it's not complete. So next is that go back to the so next maternal health strategies. So if we see that the paradigm how it's shifting, 1980s we have just used to just identify the high risk which were done by the trained TBS. But early 90s, that the pregnancy faces risk and SBA care both came. In the late 90s, cross-cutting issues, and next we are coming to the social determinants of the health. So that this is the health strategy paradigm is shifting. For that reason, we have to see the whole matter in a social determinants of health, so that our focus will be different.
Next, lanjut.
Yes, there are 10 ways we are thinking that the 10 ways to improve the quality of care in health facilities, which is given by WHO. First of all, the pregnant women should receive the right care in the right time. For that reason, whenever she is pregnant, you have to identify, access, and provide. If she is not coming to you, all healthcare providers, you have to reach her. You have to go to her. Women have to be provided with routine assessment on admission, during labor, childbirth, and given appropriate care timely, so that we can, from the very beginning, we can save the health of the women. Okay, next.
Selanjutnya. Next slide.
Actually, preconceptional counseling, if her condition is not allowing to be pregnant, so we have to healthcare providers or nurses, midwives who are working in the community field, we have to do the preconceptional counseling, and we have to tell her whether her hemoglobin level is proper or not, whether her health is at optimum level or not, so that she can take the pregnancy. And not only that, after pregnancy, if she's all right and fine, they can conceive. And thus after conception, the early registration is to be done. Not only that, focused antenatal care, at least 4 we used to tell, but usually whenever she feels she can fall and she can take the help. And immunization, supplementation, all those things we know it, normally we are doing. Not only that, every step, if we assess her properly, then early identification of the high risk pregnancy during intranatal period, that after delivery, birth anomalies, and partner violence, intimate partner violence, all those things we can do it. So for that reason, we have to very clear that the early identification is to be done. Next.
Selanjutnya.
And partner involvement. I don't know whether other countries what they are doing. You have to allow her husband or close relative, that the support person into the labor room, so that they will understand, they will feel the pain of a woman. For that reason, and not only that, they will provide the support. For that reason, family acceptance will be more, and not only that, this will be done from the antenatal counseling period only, that who will be with her, and the family support, family partners involvement will really see the family will accept the family planning method, and there will be just help also to the women. For that reason, we have to think about that also. Next.
Selanjutnya.
Next slide, please.
Selanjutnya, Mas Aris.
Yes, this is a family health and antenatal services. It is already done in all over the country, so we know it very well. So nothing to tell about that. Next.
Okay, next, Mas Aris.
Yeah. Next point is newborn. we know it very well that we have to. I have told now that just newborns. If we take care properly of the newborns, then newborn death mortality rate we can reduce. For that reason, quality measures to be taken. Healthcare has just input what all things are there. You have to check all facilities who is doing the delivery. So whether they have everything or not to keep the newborn resuscitation. And so the health facility has written up-to-date clinical protocols for essential newborn care that are consistent with the WHO guidelines and are available in the labor room and child health areas in the maternity unit. In the just in a area of the newborn resuscitation corner only, everything will be written. So that, and not only that, all the trained personnel, I will come later on, all the trained personnel will be there. If someone is new, so that she will also not face any problem if the protocol is given on the board only, so that she will be able to provide the care. Okay, next.
Lanjut ya, Mas.
So health facilities should have local arrangements such a mechanism to maintain a documented room temperature. We know it very well that because the baby is here, we don't want any hypothermia. For that reason, that temperature. Nurses, we may have the problem, but the think of the newborn baby, so that the baby will be in a safe position, so that we can prevent the hypothermia also. And healthcare staff in the labor room should receive at least monthly drills or simulation exercises and supportive supervision in essential newborn care. There is no compromisation, no matter of any compromisation, and support breastfeeding. Just after the breast, there will be breast sprawl, and the baby will come and the baby will start breastfeeding.
Next slide.
So the health facility should have supplies of the sterile cottage. I know all those things are there, and CNE will be just at least once in every 12 months. There will be CNEs, and all units should be just supportive. That the whatever service my nurses wants to give, all my environment should be supportive to give all those services. Next.
Selanjutnya, Mas Haris.
Yes, process. That is the delayed cord clamping. Unless it is contraindicated, that is premature baby. If we do the delayed clamping, baby will get the blood. And dried thoroughly soon after birth, early initiation of breastfeeding, skin to skin. I know on complete assessment of the newborn there only, so that early identification can be done for any newborn anomalies. And so that if we do all those things, then outcome will be newborns maintain the normal body temperature, and after examination, we can do the congenital abnormalities. We can identify, so that next slide, please. So that we can provide the quality care, and we have to take care. And if the baby is small, if the baby is sick, then should be cared well in a facility. We know the kangaroo mother care facility. I know all states are now giving sick newborn care unit. In our India, we have started so many sick newborn care unit, and NRP should be displayed and infection control protocol, because my babies are dying due to just timely they are not getting the NRP and newborn resuscitation and infection. These are the things we have to take care. Then we can save our small and sick babies. Next slide.
Lanjutnya.
Yes, next, no need, because my staff nurses will be able to. I know all nurses who are working in the labor room must be trained in NRP, newborn resuscitation, and they are infection and breastfeeding. They know it very well. Next.
Selanjutnya.
So every women and newborn condition that cannot be dealt effectively with the available resource. So all just I have told now, if I want to give the care, but my institution is not having all those equipment, so how can I give? So standard protocol must be there, standard guidelines might be there. All the leaders, they have the show the leadership, because you every day you go for round and check it. The way the standard protocol is there on the wall and guidelines are there, and your hospital is a well-equipped hospital. Everything first after taking the handover, you have to check that this is the well-equipped and all things are working well and in service. And always you just give continuously the mock drill also. And if there is no client, then do the mock drill and arrangement of service and continuing nursing education. Always you have to update the knowledge and skill of the nurses. Next.
Selanjutnya.
See, preterm newborns who could not be managed with the health facility should be transferred. Yes, my nurses must know how much I can give and when to transfer the baby to the specialist. so that and whenever you are transferring the baby, please maintain the warm chair and just be with the baby so that you can give the standardized referral note. And also that if we do all those things, we know it very well that labor room ward will receive immediate attention on arrival of the health facility. If it is in the rural area, they will come to the hospital and they will be received, because we have to inform them over telephone that this is the condition and we are going. So here the nurse's promptness will help to save the life of the newborn and the mother. Next.
Selanjutnya, Mas.
All women and newborn must receive care that prevents hospital infection. Nothing to tell about that. We have to reduce the nosocomial infection and reduce the hospital stay. Then only we can save the infection from of the mother and the newborn. Next. Next. Yes, appropriate physical facilities. Your antenatal OPD, safe water, electricity, well sanitation, waste disposal system, hand hygiene, maintenance. It is for the leaders. Please maintain all those things. The adequate supply. I have already told. And a good counseling to all level of staff. My nurses will not be able to do it alone because they need, it is a teamwork. So you have to inform all doctors and all nurses as well as all the other staff also. So that it's a teamwork to, if we see all those physical facilities, it's that we can overcome the barriers. Next.
Selanjutnya.
Yeah. Now we are coming to the respectful maternity care. Everywhere we are telling, because we want a positive. Every mother receives support to strengthen her capability during childbirth. Not like scolding, nothing. We don't want anything. We want their choice, their emotional support that is sensitive to the mother's need and strengthen the women's capability during the childbirth. And we have to always process
yang sudah raise hand untuk lower
option to experience the labor and childbirth with the companion of her choice should be offered. Harmful practices during the labor, childbirth, and early postnatal period are to be strictly restricted so that every unique human being is a unique. They want the respect from individuals. If the respect, then they will have a positive justice. Childbirth is a really good experience. So we want that respect, through that respectful maternity care, we want that good experience for the rest of their life. Next.
Selanjutnya, Mas.
So we know it, you all know all the countries nowadays we are maintaining in our labor room and antenatal and OPD everywhere we are, this is their right. So information, all the privacy, they have the right to the companion, food and drink in the first stage of labor and light drinks and move in the first stage during the first stage of labor, they will move according to them, that they can practice the right position and after delivery, that keeping the mother and baby. So that my nurses will be so respectful that they will recognize the service of the nurses, so that our nursing profession will really enlightened. Okay, next please. Next.
Selanjutnya, Mas.
Yeah, this is the right positive birth experience. Yes, I'm going to be the mom and my baby and nurses are there to have that experience, to provide that experience. So this is the human right of every woman. We have to follow it. Next.
Oke, selanjutnya.
Yeah, communication with women and their families. This is a very important thing. What is going on? Because her husband is waiting outside. He is thinking what is going on inside. So they must receive the information, their care, and should be involved in all decisions. You can take, you just take, they will be happy, my mother will be happy, and yes, our nursing team, our healthcare force will be very happy. Next. So communication is a really key point. Next, please.
Selanjutnya.
Effective communication between the health providers and the patients can reduce unnecessary anxiety of the women and make childbirth is a positive experience, which our nurses' responsibility for our women. Yes, we can take this responsibility. We can take the charge of that. Next, please.
Selanjutnya, Mas.
We want well-trained, dedicated, motivated staff, a skilled birth attendant. Because your skill, your two hands can give the nurses dignity, and they will, rest of their life, they will remember you, your appropriate competence, your skill to meet the requirement during labor and early postnatal period. Very much important. And you know, nurse practitioner in midwifery is a separate cadre, nurse practitioner midwife. separate cadre. They can cater these services very well as observed in developed countries. I'm so sorry, this is I am written developing. Developing countries, you have to adopt the MPL because that cadre, they know my pregnant woman very well, so that they can take from the antenatal period to rest of their. So they are expert, they are knowledgeable, they can provide the service in a continuous manner. So that this is very important. This cadre is a dedicated cadre for the maternal health services. So they can transform in our health services. Health facilities should have sufficient numbers of educated, competent, licensed, and regulated people. That is it. Next.
Lanjut ya, Mas.
And health facilities should provide an enabling and supporting environment from the professional staff development with a regular supportive supervision and maintenance. Yes, my nurses may not know all those things, but their supervisors are there. They will mentor, they will help them hand-holding support, whatever we are telling. And we have observed here in our West Bengal also, we have done so many hand-holding projects. And we have seen this is really this work at that situation, how my nurses will work. It really matters. And it's a positive impact also. The health facility should facilitate interprofessional collaborative practice also. What doctors will do, what nurses will do, what students will do. So everything, if we do it in a collaborative manner with clear roles, who have done this are not like the clear roles and responsibilities based on the professional scope of practice and care needs during labor and the early postpartum, really it will help. And my nurse leaders who are there in the labor room of antenatal or any maternity, they will take the who will do which work. So they can just differentiate the clear roles and responsibility so that there will be no overlapping and every mother will get the quality care from everyone. Next, please. Yes, last but not the least, that every woman and woman should have a complete, accurate, standard medical record because recording is very much important. My nurses are working well, but they are not recording properly. So at the same time, as you are working well, you have to go just all the baby birth certificate, complete record because medical records is very much important for documenting care, clinical follow-up, early detection of complication, health outcomes, and not only that, health to infinity. Because nowadays, patient parties are very much legally, they are very strong. So for that reason also, nurses, you have to write down everything in a proper manner so that for any need, we can use your records. Next.
Next.
Details of newborns, including vaccination, gestational age, birth weight, and examination filing should be recorded. Yes, recording must be in a proper manner. Next, please.
Next.
Yeah, when we can just when should strategies focus? Where to start and where to end? You can see there is no starting and no ending. Come start from the infancy. Yes, nurses are there to take care of the infancy. And from their preschool age, that is under 5. So here so many responsibilities are there, vaccination, all those things. Their health, deworming, all those things. School age, after that adolescent period, adolescent clinic and their contraception and their health correction, everything. After that, they will be conception period, then pregnancy. Nurses are doing this, and we know it very well. All antenatal clinics they are running, and properly you have to assess fertility problem, and after the delivery also antenatal care. Only this is nurses are doing competent nurses. They have to provide the good intranatal care so that we can, after that 9 months, 7 days, we can give a healthy baby to a healthy woman. That is our achievement only. And in the postpartum period, you know, 1/3 of the deaths are happening in the postpartum period. Until the antenatal care and delivery, we are doing everything. But whenever coming to the postnatal period, there is a lacking. So that maximum death due to infection, PPH, and all those things, postnatal deaths are there. So there also we have to take care. So that this is a complete cycle. When should strategies focus? Everywhere. In all the points, we have to focus so that our cycle is complete and we can give the strategies. How can we improve the maternal health? From the very beginning, we have to start. Next.
Lanjut ya, Mas.
Yes, challenges and issues. I know we have to increase the political commitment and willingness. You know, after this COVID-19, really nurses are getting the importance in the healthcare services. So here we have to increase the political commitment and willingness also. that underdeveloping countries there especially, and raising intersectoral coordination to address the cross-cutting issues of mental health. Not only that, we have to establish up-to-date data bank in low-income countries, making arrangements between the socio-cultural and the religious practices, which is harmful religious practices. Rather, I would say harmless religious practices doesn't matter, but harmful religious practices, we have to try to stop all those things with the maternal health care and use of family planning services and abortion practices. Maternal health care of the affected and displaced women during conflicts and wars, we have to take care of that. And continuation of the financial incentives, support, and the involvement of the private sector in the maternal health care will also be taken care. Next. Yes, our future actions, prevention of unwanted pregnancy by family planning and safe abortion. You know, in our some of our states in India, where we are unable to stop the teenage marriage. So what we are doing, as we are, this is a social problem. So as we are unable to stop the teenage marriage, so we are just trying to do the just lengthy the gap, the first pregnancy, so that the girl is going to the beyond the teenage. So that we are making that gap. So provision of institution delivery, we have not only that, emergency obstetric care services and special infrastructure hospital care by NPMs, because NPMs cadre is very much required, nurse practitioner midwives, because they are the dedicated to detect and treat early complications and to refer without any delay. And investigation into maternal death. If one death is there, you have to investigate where is the problem. You have to do the root cause analysis. Where is the lacking? Don't scold, don't punish anyone, because you have to identify root. You have to identify the cause and analyze it so that you can correct it. You can reconstruct the system and ensure 24 hours professional care at all levels, strengthen the financing scheme, including the case also. Next, please. So in my conclusion, I want to tell that inequalities in the risk of maternal death exist everywhere, both between and within the countries. Single strategy will not be enough to optimize maternal health worldwide. Urgently require public health strategy to reduce maternal mortality, particularly in underdeveloping countries. Consensual and multi-sectoral efforts are inevitable parts of the global maternal health strategy. Need to establish data bank, particularly in the developing countries. What is going on, where to give the most importance, and what continuous basis we have to take care. Next, please.
Next, lanjut, Mas.
Yes, thank you very much. Really, it's a wonderful opportunity for me also to tell about India and all those things and strategies also. Thank you very much.
Okay, thank you, Prof. Smriti. It's a very important information and also a wonderful time to us to see your presentation. And I really agree to you. We will do the transforming for health service and to reduce the cost effective of the medicine and treatment. Our speaker before say about the transformation into digital health transformation. So we must do and we must move to the telemedicine. So everywhere a woman in the rural, in the tribal areas, in the urban areas can do or can have good medical services. And I really agree too with you about every mother, every mom or woman must have a complete medical records. And we must be focused to unwanted pregnancy. This is very important in Indonesia too. Okay, thank you, Professor Smriti. We have a question for you, but we do the panel discussion. So we will hear the second speaker's presentation. Can say, Professor Smriti?
Yes, I will say.
Okay, thank you so much, Professor Smriti. Oke, teman-teman, Bapak Ibu sekalian, hadirin yang saya hormati, kita sudah mendengarkan tadi presentasi dari Prof. Smriti yang tentunya sangat berrelasi sekali dengan apa yang disampaikan oleh pemateri sebelumnya tentang kita harus bertransformasi dalam hal pelayanan kesehatan. Setiap perempuan itu harus mendapatkan pelayanan kesehatan yang komprehensif. Sudah dijelaskan juga 10 cara untuk meningkatkan kualitas pelayanan kesehatan by WHO. Oke, tentunya tidak sampai di sini, kita akan mendengarkan juga pemateri yang kedua yang tentunya informasinya sangat penting dan sangat menarik. Sebelumnya saya akan menyapa dulu beliau. Okay, we will continue to the next presenter, our honorable speaker. I will say hello first. Hello, Professor Amel. Professor Amel?
Yes, good morning.
Good morning. Thank you so much for taking your time today to give your presentation.
Thank you. Thank you for your invitation. Good morning from Saudi Arabia. Now 5:40 in Saudi Arabia time.
Oh, 14. Okay, thank you. Are you stay healthy? I hope you stay healthy and happy.
Thank you very much. I'm happy. Thank you. Thank you very much.
Okay, thank you. Before you start your presentation, let me read your outstanding curriculum vitae first. Maybe? Okay, Professor Amel, if you give me permission, we will share your curriculum vitae. So all the participants can know and, oh, this is Professor Amel. Okay, it's this. Okay, the name of Professor Amel is Amel Daud Kamel Gudia. Is it correct?
Yes.
Okay, I can say, I can tell your name, Prof. Amel or Prof. Gudia. Amel is okay?
Yeah.
She's in the Faculty of Nursing from Cairo University, and but now work address in College of Nursing, King Saud bin Abdul Aziz University in Riyadh. She is assistant professor in maternal and newborn health nursing, College of Nursing. She is also a lecturer of maternal and newborn health nursing in Faculty of Nursing and editorial board of many international journals. You can see that, and also the academic position is a lot of the experience. He is very expert, so I cannot read one by one because a lot of the experience. And you also know the Professor Amel is also the international speaker. She is a scientist and also have a lot of the scientific paper also. You can see that. Oh, it's very.
Thank you very much.
Very happy and it's a pleasure to ask and see and can hear your information based on your presentation. Okay, Professor Amel, you have 20 minutes maybe for presentation, and after that we will open the answer and question session. Okay, Professor Amel, take and time is yours.
I can share my screen.
Yes, of course, you can share my screen, but if you have any problem, we will back up your PowerPoint presentation.
Okay, you see my slide?
Yes, I can see your PowerPoint presentation, but it's not full screen. Maybe you can make it full screen first.
Full screen now.
Oh, in my screen is not full screen right now.
I did full screen.
Oh, maybe we have some problem in the
full screen now.
No, not full screen. Still the first page. Maybe if you give us permission, we will share your presentation. We have the backup for your PowerPoint presentation.
Okay, you can share.
Yes, of course. Thank you, Professor Amel. You can stop share, and the computer you can share the PowerPoint. Okay, Professor Amel, you can see the PowerPoint.
I see my PowerPoint now.
Yes. Okay. Now is full screen.
Yeah, full screen.
Thank you. You can start your presentation.
Thank you for the presentation. Yes. My topic today about challenge and innovation in maternity nursing during COVID-19 pandemic in Saudi Arabia and in Arab world as well as in all world. Next. As you introduce me, I am Amal Dawood Kamel. Assistant Professor of Maternity Nursing, College of Nursing, King Saud ibn Abdulaziz University for Health Science National Guard, and the member in Global Health Committee in Singapore for reviewing about 20 conferences per year. Next. COVID-19 has impacted our country and the healthcare professional in a way we could have never imagined. Not our country only, but all country worldwide problem, and still present. This pandemic has created myriad of questions and concern, including how to care of patients we serve while taking care ourselves and protecting our family and friends.
Next.
What a different few months make different change in education and practice and psychological and everything worldwide.
Okay. Lanjut, Mas.
How will our organization adapt to post-COVID crisis environment? What lessons have we learned? What will transform us the long term?
Yes, next.
How can nurses best respond to this challenge? By continuing to make more of difference in life of women and newborn than ever.
Lanjutnya, Mas.
Like you, I do appreciate that the coronavirus crisis has demonstrated the value of nurses and physicians and all healthcare providers, and it has led a global appreciation of work that we do every day.
Okay, next, Mas.
Emphasize the scale of profit to educational activity global in response to pandemic.
Next.
Point particular interest focus on sound educational because it's my specialty as education, as a part of education in world Arab in Saudi Arabia or in Egypt. Principle align objective with teaching resource and assessment that allow for more formative experience.
Next.
Address existing and impending healthcare facing women and newborn. It is a very critical area, women and newborn during pregnancy and during early postpartum period, especially during COVID pandemic. Innovation in response to COVID pandemic.
Next.
In education, firstly.
Next.
A global pandemic has resulted in international suspension of face-to-face teaching in education and institutions. This unprecedented international emergency has required nursing educators to create online learning package to replace face-to-face teaching or physical teaching to support students in their self-directed study in response to pandemic and how to alternative OB and gynae nursing education was delivered using e-learning methodology. Especially this is have very problem in Egypt or in Arab region because all teaching before crisis or before pandemic, physical teaching only. This change and convert from physical to indirect teaching or online teaching. It is in the first time of COVID, very pandemic because have internet problem. Many students don't have a laptop. This change causes very crisis, especially in education in developed country. Next. We created an e-learning guide with package of learning resources for undergrad. Our aim was replicate as far as possible to experience the exposure the student would you have face-to-face in our department. Next. Challenges. Replacing teaching within clinical environment to virtual platform was challenge and required collaborative approach from both teacher and learner, especially in Egypt. Have internet problem, internet very expensive to the student. Next. Clinical teaching was the biggest challenge to replicate electronically, which was based on the approach of virtual clinical teaching. Each virtual clinical will have a sample task for every patient to provide a plan of care for the patient. Assessment during the clinical attachment, the student would you have submitted a case report, which would be summative assignment formally marked and graded. Clinical innovation, JADA. This is an innovation or new innovation using for stop postpartum hemorrhage. Next.
Next.
JADA provide definitive visible control of postpartum hemorrhage within minutes through action of uterus contraction and relaxation and vacuum of the blood from the uterus. Next.
Next.
Use genital vacuum induce the normal function of the uterus, helping mother body initiate contraction and taking back control, contraction and relaxation. The result is rapid cessation of bleeding during postpartum with visible result is prove it. Next.
Next.
Fast stop bleeding in 3 minutes.
Next. Selanjutnya Mas Arif.
Preventive, observe and measurable confirmation of hemorrhage control. Next.
Selanjutnya Mas.
Next.
Selanjutnya.
Vacuum pros cervical. Next slide. Cervical cell, vacuum contractor, and the vacuum bag for aspiration and collection of the blood from the uterus. Next. Service. Innovative topic example addressing neonatal skin care, assessment on preterm labor, implicit base in maternal care, and much more. COVID-19 chat, live online prenating, lactation classes, prenatal classes, mother classes online through WhatsApp or through Zoom meetings, health education about danger signs during pregnancy, about family planning method, about breastfeeding, preparation for birth under the COVID-19 classes, mental health support group for pre-post, natal anxiety and depression. Next. Many studies done in Egypt about assessment of anxiety level and depression during pregnancy, during attack of COVID, and they revealed anxiety level very high and depression level very high. Telehealth consultant classes to help support this risk mother, baby life advice, educational training over the phone, and realize how to much women enjoy this personalized interaction. Virtual class, virtual care team online through the phone to improve in adherence and health outcome for entire family. Social media, increase social media use, post unique challenge for educator. Live online prenating, lactation classes, preparation for birth under COVID-19 classes, fertility and pregnancy group, online classes or in by Zoom or through WhatsApp group. Get care for this postpartum birth warning signs, pain in the chest, obstructed breathing, seizure, thought of hurting yourself, of your baby, bleeding, incision that is not healing, red or swelling leg, signs of DVT, hemorrhage, headache, increased body temperature more than 38. All of these symptoms during postpartum, the women should be call or notify her physician. Next.
Next.
And should be instruct women during pregnancy about danger signs and should be contact directly with her physician through some danger signs as severe headache, change in your vision with persistent headache, increased body temperature, swelling and redness of leg, absence of fetal movement or diminished fetal movement, sudden gush of fluid from vagina or bleeding, severe nausea and vomiting, increased vomiting more than 5 times per day with weight loss, overwhelming tiredness. Should be notify physician about all these symptoms of care. Very good use condition. Next. Live online parenting and lactation classes. Baby leave advice. Okay, message. Next.
Next.
While innovative has become a hot topic in healthcare, incorporating innovating concept in nursing curricula as it is in infancy. Rapid change in our complex healthcare system requires that graduate bring new knowledge to practice setting. Next. They need the nurse active empower patient while inspiring themselves to create innovative solution to every issue is value skills. Corona develop in nursing student how to deal with crisis, how to develop yourself in through online teaching, through Zoom meeting and Microsoft meeting. All of this before Corona didn't know for all students and for teachers in Arab region. Nursing programs that build innovation. And in previous, please. Entrepreneurship skill may enhance graduate to change agent and innovator. A national conversation is encouraged to ensure our education programs that effective preparation future generation for nurses, innovator, and change agent.
Next.
Obstetric and gynecology department made multiple adjustments to confront the challenge during COVID-19. Obstetric gynecology department in Arab region done many changes. Challenge include limited mobility of patients because lockdown, limited the number of medical and nursing staff, limited access to theater, imaging service, blood bank, and laboratory service. Women come only in emergency condition.
Okay, next.
Guidance from Center for Disease Prevention and American College of Obstetricians and Gynecologists. Pregnant women should be concerned about potential for severe disease from SARS, COVID-19 infection, and the recommended measure take to protect themselves and their family from infection. If hospitalization of COVID-19 is indicated, a pregnant women care should be provided in facilities that can conduct maternal and fetal monitoring when appropriate. Next.
Okay, next.
Management of COVID-19 in pregnant patients should be include fetal and uterine contraction monitoring when appropriate based on gestational age, individualization, delivery planning, multi-special team-based approach may be include consultation with obstetrician, maternal, fetal medicine, infection disease, pulmonary and critical care, and pediatric specialists as appropriate. Next. The COVID-19 treatment guideline panel recommended potential effective treatment of COVID-19 should not be withheld from pregnant women because theoretical concern related to safety, therapeutic agent in pregnancy, decision regarding the use of drug approved for indication or investigational drug for treatment COVID-19 in pregnant patients must be made with shared decision-making between patient and the clinical team, considering safety and the medication for pregnant women and fetus. During the last 3 years, the nurse and the all healthcare team did work it's over and over and needed continuous time for appreciation through social media, appreciation through TV, and financial appreciation needed also. Thank you very much.
Yeah, thank you very much, Dr. Amel. In Indonesia, we also have the facing this challenge. Them like you don't have a laptop, don't have the signal, and all the parents say we cannot do the learning. So it's very challenging to all the
very difficult for the student and for teachers, especially in internet. It's very expensive in Egypt.
Yes, it's very expensive. So our government give the supply, but also we cannot. I think the supply is good for the people live in the city, live in the maybe out the forest in Indonesia. You know, have a rural, urban area is a bit difficult.
But my point of view, COVID-19 gave Arab region very converted, and from physical teaching to online teaching, and I am, and all teachers learned how to join to Zoom and Microsoft Team and change an ability for using the internet. This is the benefit of Corona.
Oh yes, so sharing is very important, and also it's first time I see and I know about the innovation Jada, and we have some question for Jada also, because I'm a midwife too, and the participant also asked about the midwife too, but we will give the question after the question for me, Professor Smriti first. Okay, Professor Amel?
Okay.
Okay. I will invite again Professor Smriti. Professor Smriti? Professor Smriti, are you stay in the Zoom?
Yes, please.
Yes, we have a question, one question for you from the participant. Give us the question directly. Maybe the committee, you can share the PowerPoint, the question. Yes. Professor Smriti, the question comes from Tiara. The question is early detection of intimate partner violence and domestic violence has not been widely carried out in Indonesia. What skills are needed to detect this? And what are the things that fall into this category? Because sometimes patients are not to be honest during the anamnesia, maybe.
Okay, very good question. Thank you very much. So I want to tell that when we have to take care, we have to be so close and so dear to the client, to the woman, so that she feels that yes, you are the right person to disclose all her things. And we know it very well from the very beginning that nurses are really keeping everything confidential. So we have to gain the faith of the women so that they can tell you, they can intimate you that what is going on. And looking at her, you have to tell her, you are not looking so happy today. What happened, dear? Like that, you have to be so empathetic to her so that she can expose herself to you. Then only you can identify the partner violence. Really, otherwise you cannot, because all the women, they are keeping everything close, everything within them. And you know it very well when they are keeping all those violences within them, so that they will have some stress inside them, that due to that stress there may be some problem. For that reason, it's the nurse's responsibility to be the close, to be empathetic to my client, and so that they will be able to tell everything. Okay, in this way we can really identify. They will not tell. If I ask, oh, your husband is beating like that, they will not tell. So it's the matter of faith and belief. How can she can rely on you, so that how much you are confident, maintaining the confidence, then only she will tell. Okay, thank you.
Yes, thank you, Professor Smriti. I think in India have the same problem in Indonesia when patient not to be honest, especially when they coming with their husband or their parents, they will be saying, "Oh, no problem. Oh, no problem," like this. Yes. Okay. Thank you, Profesor Smriti. Mungkin untuk peserta harap di-unmute terlebih dahulu untuk ininya, untuk Zoom-nya agar kita bisa lebih kondusif. Okay, the next question come for Professor Amel. Professor Amel, are you stay in the Zoom with us? Professor Amel?
Yes.
Okay, we have one question from the participant, give to the committee directly for you. Maybe the committee, you will share the question.
Yes.
Okay, the question come from Anita Julia. The question is, thank you for your explanation. I'm a midwife and interested in JADA innovation. How do I use it? Is there any special training that must be followed before applying it? When is the JADA action declared successful? And when is it declared failed? If it's failed and bleeding continue, what should be done?
Jada, it's not needed to very trainee or trained person, just as a caster and inhale and aspirate through the special syringe. If failed, you can then another surgical intervention as D&C, dilatation and cortage.
Oh, it's not like a vacuum. If vacuum at 3 times fall, we cannot do it again like this. If the Jada, we can.
Jada as the internal massage of the uterus, internal massage and the aspiration of the blood. This is the action of Jada.
Oh, and the innovation start in the hospital or maybe in the primary healthcare, or can do in the maybe in midwife clinical, Professor?
Started in hospital and delivery room, and can use in by midwife in primary care.
Okay, Miss Anita. Maybe because in Indonesia we have the 4th level of the healthcare service, the 3 level for the hospital and 1 level for the primary healthcare. So it's very different technique and different maybe operational standard. So Miss Anita, you can do it if you work in hospital or maybe in primary healthcare. When the doctor maybe in the room, all right, Professor Amel?
Yeah.
Yeah, when the doctor is already to maybe in the room, or the midwife and the doctor or just the midwife can do that?
Midwife can do that.
Midwife can do it. Okay, meskipun tidak ada dokternya, tapi
under supervision of the obstetrician, in delivery room.
Oke, jadi meskipun belum ada dokternya, tapi kita harus ada di tempat yang memang diawasi oleh dokter ataupun di level yang cukup mumpuni ya, seperti itu mungkin Bu Anita. Oke, thank you so much Professor Amel for your explanation. And before we finish this session, I want to give you the certificate and the symbol for giving. We will take a picture, maybe Professor Smriti and Professor Amel. Yes, I hope we can see you directly in Indonesia, or we can go to India, or maybe I can go to Arab. I hope all the people to go to Arabic because this pandemic, we just can see you in Zoom, and the symbolic of the certificate will be given by the taking a picture. Okay, maybe the presentation for Prof. Smriti first. Okay, the Klamita, you can pin the Professor Smriti. Okay, Professor Smriti?
Yes,
we'll take a picture. I will count down until 3 and give the best smile. And here, Mr. Aris Widianto. Mr. Aris Widianto come from Mamba'ul Ulum. Mamba'ul Ulum is the institution who will be the host in the conference today. Okay, I will count down. 1, 2, 3, smile. Okay, maybe with the certificate. And Mr. Aris, you want to say something or say thank you to Professor Smriti?
Yes, thank you so much, Tuti. Thank you very much, Professor Smriti Mani. I hope you can enjoy this event, and the next event you can join again. Thank you so much.
In Zoom or in Indonesia like this, Miss Aris, yeah?
Yes, of course, in Indonesia.
For meet you directly. Okay, once again, Professor Smriti, with your certificate before we give it into your electronic mail. Okay, 1, 2, 3, smile. Okay.
Tuti, one again. Take a picture, one again. Okay, 3, 2, 1. Thank you.
Okay, thank you, Professor Smriti. I hope your day is going good today. Okay, thank you. And I will invite again Professor Amel. Yes, Professor Amel, maybe the committee will take the picture of the Professor Amel. We can pin.
Thank you for your invitation, and I hope you enjoy and interesting with me in my presentation. Thank you.
Of course,
Professor. In every conference And thank you for invitation from Dr. Lavani.
Oh, yes. And we will want to meet you directly, actually, I'm a midwife, and I will so interested with your innovation. Maybe if you have a paper, we will download and we will learn about this, because in Indonesia, you know, postpartum hemorrhagic is tied to challenging. It's very challenging and very make our midwife heart break. Okay, we will take a picture, Professor Amal. 1, 2, 3, smile. Okay, maybe with the certificate, and Mr. Aris Widianto as the institution host in international conference today will say thank you.
Thank you very much.
Thank
Enjoy,
you
have a nice day.
very much, Prof. Amel Daud. We hope you can enjoy this event, and the next event, we hope you to Indonesia offline, I think.
Okay. Thank you very much. And I
Visit
hope
in
to
Borobudur
visit
or
Saudi
Mandalika.
Arabia and visit Egypt. My original country, Egypt. I am from Egypt.
Oh,
Okay.
Yes, if you come to Indonesia, maybe Prof. Amel and Professor Smriti, we will show you the culture and also the one of the, the wonderful like a Borobudur.
I am in my plan. I will come to Indonesia after the crisis.
Egypt has a pyramid, and India have, you know, the Taj Mahal. We have a Borobudur. So I hope we can meet.
I'm traveling many times to Singapore before.
Please, Amel also please come to India, and I will show you, and especially Kolkata.
Oh,
please come. Okay, thank you.
I hope, inshallah. I really hope the pandemic is over and I can come to another country to see all of the very honorable speaker and the very interesting place. Okay, once again for taking the picture with Professor Amel certificate. 1, 2, 3, smile. Okay.
Okay,
thank you so much once again, Professor Amel, Professor Smriti. I hope you will enjoy.
Thank you very much. Thank you.
Okay, ladies and gentlemen, thank you very much. Finally, we are come to the last session of the symposium in this conference. We have the 3 part of the symposium. This is the last part. I would like to thank for all the honorable speaker, international speaker, and national speaker, give us the knowledge, and also for all of you honorable participants. And also you are a good participant, and hopefully this presentation and this session will give us a benefit. Thank you for your attention, and I will remind you, you must be you must be do the best presentation after this in oral presentation room. We have a breakout room, the 3 breakout room, and you have a schedule, so you can come to your room as a schedule. And also do your best, because we have a gift for the 3 best presenter in every room. Ya, terima kasih Bapak Ibu sekalian, para partisipan yang sangat saya hormati, dan tentunya saya juga mengucapkan terima kasih kepada para pembicara yang terhormat baik dalam dan luar negeri yang sudah berbagi ilmunya dengan kita dari kemarin hingga saat hari ini. Dan saya mengingatkan kita harus, dan Anda juga harus melakukan oral presentasi di 3 ruangan yang sudah kami buat, breakout room, ya, sesuai dengan daftar dan juga schedule yang sudah Anda miliki. Jika Anda belum memiliki, Anda bisa bertanya kepada panitia terkait ruangan. Dan saya harap Anda melakukan presentasi terbaik, karena kita memiliki hadiah sertifikat khusus untuk 3 presentator terbaik di setiap ruangan. And also for the participant who asked the question from the first symposium until now, the 3rd symposium, we have a special gift for you. The committee will contact you to give your special gift from the Mamba'ul School of Health Sciences. Ya, dan untuk para penanya nih dari sesi yang pertama, kedua, dan ketiga di simposium ini kita punya hadiah khusus. Nanti akan diberikan oleh panitia dan di kotak. Hadiah ini dipersembahkan oleh Stikes Mamba'ul Ulum. Okay, as a moderator today, my name is Tuti. Thank you so much, and I will apologize on behalf of the committee if you have something, any misunderstanding, or if we have any mistake. I hope you enjoy, and I hope the international give you the best information and benefit. And I will see and wait for joining. Ya, saya Tuti selaku moderator mewakili panitia memohon maaf apabila ada hal yang tidak berkenan atau ada sesuatu yang salah dalam penyajian. Dan kami bertemu lagi dengan Anda nanti di konferensi selanjutnya. Thank you so much. Wassalamualaikum warahmatullahi wabarakatuh. See you on presentation room. Bye-bye.
Yang terkenal akan ikonnya yaitu Pulau Seribu Masjid, destinasi wisata halal serta keragaman budayanya yang terus berkembang pesat dengan kehidupan sosial masyarakatnya yang hidup heterogen, toleran, dan damai. Kini, Nusa Tenggara Barat juga tumbuh sebagai provinsi yang memiliki pendidikan yang patut diperhitungkan, menjadi salah satu provinsi yang sudah mulai dilirik dalam mencetak generasi unggulan yang berkualitas. Seiring perjalanan waktu, ternyata tidak hanya universitas negeri yang menjadi pilihan utama, karena beberapa universitas swasta juga menjadi destinasi pendidikan yang sangat menarik bagi para calon mahasiswa. Salah satunya Sekolah Tinggi Ilmu Kesehatan Yarsi Mataram yang didirikan pada tahun 1991 yang dulu bernama Akper Yarsi Mataram, lalu pada tahun 2005 berganti nama menjadi Stikes Yarsi Mataram. Stikes Yarsi Mataram merupakan universitas terkemuka di Nusa Tenggara Barat dan telah meneguhkan diri sebagai universitas yang mencerminkan gerakan profesional dan islami. Sementara itu, Stikes Yarsi Mataram secara konsisten mengembangkan 4 strategi pendidikan yang menjadi ciri khas dan keunggulan tersendiri di antara universitas di Nusa Tenggara Barat. Pertama, Stikes Yarsi Mataram mengembangkan budaya akademik Islam dalam aktivitas pembelajarannya, guna membangun karakter mahasiswa agar menjadi pribadi yang berakhlakul karimah dan memiliki kompetensi sesuai bidangnya masing-masing. Ini ditunjukkan selain dari penerapan pembelajaran yang menggunakan dasar-dasar nilai Islami, juga ditunjukkan melalui gerakan berpakaian Islami serta gerakan menunaikan ibadah sholat berjamaah. Kedua, Stikes Yarsi Mataram memperkuat berbagai kegiatan seperti pengabdian masyarakat dan gerakan sosial kepada masyarakat, yang diimplementasikan melalui berbagai penelitian yang telah dilakukan oleh dosen serta mahasiswa Stikes Yarsi Mataram. Ketiga, membangun jaringan pendidikan internasional. Dalam beberapa tahun terakhir, Stikes Yarsi Mataram terus membuka dan mengimplementasikan kerjasama internasional dengan universitas terkemuka di level internasional. Kerjasama pendidikan yang telah dijalankan oleh Stikes Yarsi Mataram antara lain bersama negara Filipina, Thailand, Arab, Korea Selatan, dan Belanda. Keempat, diversifikasi program studi yang ditunjang oleh fasilitas yang memadai. Kampus Stikes Yarsi Mataram memiliki 4 program studi unggulan, yaitu Prodi S1 Keperawatan, Prodi D3 Keperawatan, Prodi D3 Kebidanan, dan Prodi Nurse. Guna memberikan kenyamanan untuk mahasiswanya dalam proses belajar mengajar, Stikers Yarsi Mataram juga membuat konsep kelas sangat nyaman dengan fasilitas lengkap yang di dalamnya. Sebagai penunjang fasilitas utama, Stikers Yarsi Mataram juga menyediakan 9 laboratorium yang memiliki alat-alat terbaru guna untuk memudahkan mahasiswanya dalam praktek keperawatan maupun kebidanan. Perpustakaan yang telah terakreditasi ini memiliki peranan penting dalam menunjang pengetahuan mahasiswa, memiliki buku-buku yang lengkap serta jurnal-jurnal yang memadai, serta suasana di dalamnya yang sangat kondusif dan nyaman. Stikers Yarsi Mataram juga menghadirkan klinik bernama Klinik Balai Sehat, yang selain bertujuan untuk tempat belajar mahasiswa juga bertujuan menjadi tempat pengobatan bagi para mahasiswa Stikers Yarsi Mataram yang memiliki masalah kesehatan. Musola kebanggaan warga Stikers Yarsi Mataram dalam menunaikan ibadah, selain itu juga sebagai sarana dalam memperoleh kajian-kajian rutin. Gazebo ini bertujuan sebagai fasilitas diskusi mahasiswa dengan konsep outdoor yang tentunya sangat nyaman untuk berdiskusi. Yarsi Career Center adalah salah satu lembaga di Stikers Yarsi Mataram yang menjadi wadah bagi para alumni dalam mendapatkan informasi tentang meningkatkan skill, melanjutkan studi, dan karir. Lembaga Psikologi dan Tumbuh Kembang Stikers Yarsi Mataram merupakan lembaga yang mampu menjelaskan apa, bagaimana, dan mengapa tingkah laku itu terjadi sebagai tempat mengkonsultasikan masalah dan konseling.
Stikers Yarsi Mataram merupakan kampus terkemuka di Nusa Tenggara Barat dan telah meneguhkan diri sebagai universitas yang mencerminkan gerakan profesional dan islami. Stikers Yarsi Mataram mengembangkan budaya akademik islami dalam aktivitas pembelajarannya, ditunjukkan selain dari penerapan pembelajaran, juga ditunjukkan melalui gerakan berpakaian islami, serta gerakan menunaikan sholat berjamaah, gerakan kajian-kajian keislaman yang rutin dilakukan di kampus Stikers Yarsi Mataram. Kampus Stikers Yarsi Mataram kini berdiri megah dan memiliki 4 program studi. Yang pertama, program studi S1 keperawatan. Yang kedua, program studi D3 keperawatan. Yang ketiga, program studi D3 kebidanan. Dan yang keempat, program studi profesi nurse. Yang kesemua program studi ini telah terakreditasi B oleh BAN PT. Bismillahirrahmanirrahim. Mari bergabung bersama kami di kampus Stikers Yarsi Mataram, perguruan tinggi kesehatan terkemuka di Nusa Tenggara Barat, mencetak tenaga-tenaga kesehatan yang handal, mumpuni, dan kompeten di bidangnya, mampu bersaing di tingkat regional, nasional, dan internasional. Stikers Yarsi Mataram, profesional dan islami.
Saya Agung Susanto, Ketua BEM Stikers Yarsi Mataram.
Dan saya Kristi Diana Darmayani, Wakil Ketua BEM Stikers Yarsi Mataram.
Badan Eksekutif Mahasiswa Stikers Yarsi Mataram bertujuan yaitu meningkatkan kreativitas mahasiswa dan serta menyalurkan minat dan bakat mahasiswa.
Membantu memfasilitasi mahasiswa dalam bidang akademik maupun non-akademik dan mengimplementasikan nilai-nilai profesional dan islami.
Kami, pengurus Badan Eksekutif Mahasiswa Stikers Yarsi Mataram periode 2018-2019, mengajak teman-teman semua untuk bergabung di Stikes Yarsi Mataram. Stikes Yarsi Mataram,
Profesional dan Islami.
Fakultas Ilmu Kesehatan dengan 3 program studi Diploma 3, yakni Keperawatan, Kebidanan, dan program studi Farmasi, merupakan lembaga pendidikan tinggi yang berdiri di bawah Universitas Nahdlatul Ulama Mataram yang bertujuan untuk mendidik warga masyarakat NTB serta masyarakat Indonesia pada umumnya agar menjadi sumber daya manusia yang mempunyai ilmu dan keterampilan, khususnya di bidang kesehatan.
Lanjut studi kesehatan, FIKUIM Mataram aja.
Jurusan Keperawatan Universitas Negeri Gorontalo merupakan salah satu jurusan yang ada di Fakultas Olahraga dan Kesehatan. Program studi keperawatan Fakultas Olahraga dan Kesehatan Universitas Negeri Gorontalo telah berdiri sejak tahun 2008. Pada tahun 2013, prodi ini telah mendapatkan akreditasi C dari BANPT, dan pada bulan November 2017 telah diakreditasi dengan peringkat B baik pada jenjang S1 maupun profesi nurse. Lokasi jurusan keperawatan berada di area Kampus 1 Universitas Negeri Gorontalo yang beralamatkan di Jalan Jenderal Sudirman, nomor 6, Kota Gorontalo. Visi dan misi program studi nurse Fakultas Olahraga dan Kesehatan Universitas Negeri Gorontalo. Visi menjadi program studi yang unggul, berakhlak dan kompetitif dalam bidang keperawatan gawat darurat di kawasan Asia Tenggara pada tahun 2035. Misi 1. Menyelenggarakan sistem pembelajaran keperawatan yang inovatif seperti melakukan problem-based learning, case management, forum group discussion, dan metode lainnya melalui penyelenggaraan kurikulum yang komprehensif serta tersedianya sarana dan prasarana yang menunjang terwujudnya lulusan keperawatan yang profesional, unggul, berakhlak mulia, kompetitif, dan profesional dalam menerapkan keilmuannya, khususnya di bidang keperawatan gawat darurat. 2. Menyelenggarakan penelitian dalam bidang ilmu keperawatan yang inovatif sebagai evidence based untuk meningkatkan. 3. Menyebarluaskan ilmu pengetahuan dan teknologi dalam bidang keperawatan melalui pengabdian pada masyarakat yang menunjang kegiatan akademik dan bermanfaat untuk meningkatkan derajat kesehatan masyarakat. 4. Mengembangkan kerjasama dan kemitraan di dalam dan luar negeri dalam menunjang pelaksanaan Tridharma perguruan tinggi.
Assalamualaikum warahmatullahi wabarakatuh. Selamat datang di jurusan keperawatan Fakultas Olahraga dan Kesehatan Universitas Negeri Gorontalo. Jurusan keperawatan telah didirikan sejak tanggal 17 Desember tahun 2008 pada Fakultas Ilmu-Ilmu Kesehatan dan Keolahragaan yang saat ini telah menjadi Fakultas Olahraga dan Kesehatan. Selama kurun waktu 11 tahun ini, alhamdulillah prodi keperawatan telah memberikan pelayanan akademik kepada
Ya, Bapak Ibu sekalian, untuk kami bantukan memasuki ruang room, boleh di rename terlebih dahulu namanya. Jadi room berapa, underscore nama. Panitia akan membantu memasukkan Bapak Ibu sekalian ke room untuk para
Bude sampun perso, nanti tinggal di order lagi.
dengan optimal, di mana sarana dan prasarana telah kita sediakan dengan maksimal mungkin seperti ruang kelas, laboratorium, ruang baca, perpustakaan, dan beberapa fasilitas pendukung akademik mahasiswa lainnya. Nah, untuk menunjang akademik, juga kami didukung oleh tenaga pengajar atau dosen dengan seluruhnya berkualifikasi S2 dan S3 di bidang keperawatan dan di bidang kesehatan. Lulusan dari prodi keperawatan adalah perawat dengan kualifikasi nurse yang saat ini telah meluluskan nurse sebanyak 741 orang yang terbagi dalam 10 angkatan. Sebagai bagian dari profesi kesehatan, maka
Pun sini. Oke, siap-siap. Sekarang ya, Mak. Oke.
Kak,
Tenang, memang janji loh, Mama. Heeh. Ini oleh-oleh wes tak cepat ngene, Mama. Heeh. Nggih. Wes pokoknya ya Allah. Monggo, Pak. Assalamualaikum.
Kalau udah join namanya
Saya belum masuk di rumah ya.
Baik, Bapak Ibu sekalian, ada 48 peserta lagi untuk dimasukkan ke ruang presentasi. Harap untuk mengganti atau merename nama Bapak Ibu sekalian, di depannya dikasih room-nya berapa. Nanti kami akan membantu masukkan ke dalam ruangan presentasi oral.
Selamat pagi panitia, mohon info ruang Zoom berapa peserta. Makasih. Halo panitia, selamat pagi. Tidak jelas ini. Oh, tidak ada absen. Oh, kenapa tidak ada absen lagi hari ini? Tidak akan.
Assalamualaikum Kak, bisa dikasih masuk di ring 2?
Repot. Payah penelitian.